Hi, Dr. John Torres here on my Facebook Live Daily Doctor, where a couple of times a week I go over headlines, give you information behind those headlines. And my main point is to try to give you information that you can use to help you, your family, your loved ones, your community stay as healthy as possible and get through this pandemic as quickly as possible. I also add in other health topics beyond the coronavirus from time to time, but today we'll mostly be focusing on coronavirus because of our upcoming holidays. And I'll talk about that in a little bit about Thanksgiving and travel and some thoughts I have as far as travel is concerned. But the main point here is that you want to be safe this holiday season, and the holiday season is coming up because what we're seeing right now is an increase in number of cases. Now, by that, what I mean is the case numbers are going higher. Right now, we're a little over 90,000, around 94,000 cases a day here in the U.S. When you look at other countries, there are other countries, particularly in Europe, that's getting hit hard right now that have higher number of cases and higher case rates. And we'll talk about that in a minute, why that's happening. But this is just before the holidays settle in here, and so those cases could go even higher. Luckily, hospitalizations and death rates are not as high as they used to be compared to the case rate, and hopefully they stay that way and go even lower because that tells us that the vaccines are kicking in, they're starting to take effect, more people are getting them. But when you look at the overall numbers here, there are a few trends that we're noticing that you want to make sure you understand those trends because those could be repeated here if we don't do certain things. And particularly when you look at Europe, I just got back from a working trip. I went to Spain. And in Spain, they were very adamant about wearing masks indoors. It's mandated there across the country to the point where there are a couple times where outdoors you typically don't wear a mask, especially if it's not a crowded area. And we've all been to the situation before where you've been without a mask, you forget whether you have a mask on or not, and you go into an area that requires a mask and you don't realize you don't have it on. Well, there were two times I stepped into stores without a mask, and immediately I had three people tell me, you can't be in here without a mask. I had to step outside, pull my mask out of my pocket, put it back on, and then go back into the store. I was very appreciative they did that. And those results are showing, and here's what I'll explain to you. Right now we're seeing across Europe kind of a dichotomy, a difference in different countries as far as the case rates they're having out there. And the biggest case rates they're having right now are happening in a few countries. Netherlands right now, and to go over the specific numbers here, and this is per million people, they have 1,258 cases per million people. Denmark, 668. For the countries I've looked at, this is the second highest. United States, 285. Spain, 120. Now, if you switch over to vaccination rates, Denmark, 78%. Spain is 80% fully vaccinated. That's all the population fully vaccinated. Netherlands, 73%. And if you go down to Latvia, they're in the 62, 63% range. And let me pull that up here real quick, just so I'm giving you accurate numbers. But the thing here, there's a few differences. I was in Latvia, 62%. So I was in Latvia about a month and a half ago on a working trip as well. And there, they're also adamant about going inside with masks. You have to wear masks everywhere. And you had to show your vaccination card to get into restaurants, coffee shops, those types of facilities. And they were very adamant about if you didn't have a card, you couldn't go in there, to the point where some places didn't recognize the CDC card we had. They wanted the QR code that the European Union comes up with. We don't have that, so there are some places we weren't able to go into. But when you look at the rates, Latvia is having some issues as well with their rates. And as a matter of fact, their number is 436 per million people of cases out there. So what am I trying to explain with all the numbers here? Well, there's a couple things going on. When you look at the countries that have high vaccination rates but aren't mandating the other protective measures, masking and social distancing, their numbers are very high. And again, I talked about Denmark, 78%, 76% vaccination rate. Compare that to Spain's 80% vaccination rate. And that's the full population from zero up through death. And so again, they have very high vaccination rates, especially compared to us here in the US. But the difference there being Spain's case numbers are low, Denmark's case numbers are very high, to the point where the U.S. just put Denmark on a do not visit list because their cases are so high. So what's the big difference there? Well, their vaccination rates are almost equal, but Denmark doesn't have any mandatory mask policies, whereas Spain does. By the same token, when you flip that coin over, Latvia to Spain, Latvia's rates are very high, Spain's rates are very low. Difference there being that Latvia has mask mandates, Spain has mask mandates, but Latvia's vaccination rates are low. So what this is showing us is that what you need right now at this point, especially because these cases are cropping up, is multiple things to protect everybody. Vaccinations, you want the rates to get high, as many people vaccinated as possible, but you also want masks, particularly indoors. And we're seeing that these mask mandates are working. I know people here in the U.S. are a lot of times against the mask mandates, but for public health purposes, they are working very effectively. In most places you go to here in the U.S., they say, we recommend you wearing a mask. You can certainly wear a mask if you feel uncomfortable without a mask, and I encourage you to put one on when you go indoors, especially as we start to see these numbers go higher and higher. And what we're going to see now is these numbers go higher and higher as the weeks and months go on here, simply because of travel, the holiday season, the more cold weather. We know this virus is more active in the winter. I don't think it'll get to last winter's numbers, but I think we'll still see numbers of cases going higher, hopefully not followed by hospitalizations and hopefully not followed by deaths. I think we're getting that more under control, but we definitely need to get our vaccination rates high. And if you look at here in the U.S., our fully vaccinated population is only 58%. Again, compare that to 80% in Spain, 76% in Denmark. And so we're lagging behind here. Hopefully more people get vaccinated. And then, of course, booster shots are out there as well. So it's interesting seeing what's happening around the world. And I think that's good lessons for us here, too, that having multiple measures, vaccination rates high, people masking indoors, those are keeping case numbers down, as in Spain. But in countries where they have high vaccination rates, but no mask mandates, like Denmark, numbers are going up. In countries where they have mask mandates but low vaccination rates, like Latvia, cases are going up. And so we're seeing those multiple measures are what seem to be keeping cases down. And of course, we'll see as time goes on what happens with these things. And what you're noticing in a lot of countries right now, Germany is imposing new restrictions. Denmark is going to start imposing new restrictions. Netherlands, who also were having some issues, are imposing new restrictions. And so as case numbers go up, hospitalizations get inundated in these countries. They're starting to impose more restrictions, meaning sometimes lockdowns, sometimes mask mandates, sometimes those things that we know work, but oftentimes politicians in particular are hesitant to do anything about. So that's what it comes to around the world and what's happening with COVID cases around the world. Like I said, here in the U.S., our numbers have popped up. If you remember, we were down to around 70,000, seemed to plateau out, wasn't really going any lower than that, and then it started creeping up. Well, now we're about 94,000, and we're coming into our travel season, our get-together with family and friends season, and that's when we're worried that numbers might even go higher. So hopefully we can keep a good eye on that, keep it under control to a certain extent. Now, the other one I want to talk about, and we've been hearing about this, what we call anecdotally, meaning that doctors I know across the country have been telling me that they're seeing more cases of stillborn births. But nobody had really put the numbers together to see if this was actually true until now. A study came out putting all these numbers together, and it's unfortunately very, very bad information. And another reason why people who are pregnant should be getting vaccinated, because we know COVID can be disastrous to the mother, to the infant, to the developing baby, and can result in these stillborns. And what I want to talk about is a study. They actually looked at over 1 million pregnant people throughout from March of 2020, so last year when the pandemic was first declared, until September of this year, just a couple of months ago. Before the pandemic, this is before the pandemic, the rate of stillborn was under 1%. It was 0.59%. In the pandemic, for people who did not have COVID, the rate was 0.64%. So fairly the same, just about the same for people who didn't have COVID. But once people had COVID, that rate jumped up. It went up to almost 1%, 0.98%. And so, again, going from 0.64 to 0.98%, that's a definite increase in the number of stillborns. But, and this is the important caveat, once Delta came along, that number skyrocketed. And it went from, again, pre-pandemic 0.59 to those who got COVID during the Delta season now, where the Delta variant is prominent, 2.7%. That's a 4.5 time increase in stillborns and people who ended up getting COVID. So again, it's showing you just how disastrous this can be. Why is this happening? Well, we don't think the virus is particularly attacking the baby, the developing baby. We don't think the virus is particularly attacking the placenta. But what we think is happening is mother is getting COVID, mother-to-be. That COVID is causing oxygen restrictions in her body. Her oxygen levels aren't as high. And because of that, oxygen is not reaching the placenta, which means it's not reaching the developing baby, which means that developing baby has some issues and can get into fetal distress and can result in these stillborns. So again, numbers here just so you understand. Before the pandemic, 0.59%. That was the rate of stillborns across the population. After the pandemic, once Delta hit, for those who had COVID, were not vaccinated, ended up getting COVID, 2.7% was the rate of stillborn. That's an over 4 times increase in stillborns from somebody who got COVID to somebody who, before the pandemic, didn't have COVID. And so again, very daunting news, but I think news that's important and shows why pregnant women need to get vaccinated. It's very safe for them, and it's showing to be very effective. And we're now seeing that this happens. The other study that came out showed that women who were vaccinated, those antibodies from vaccines ended up passing on to their infant. They did for people who had natural immunity as well, but they did definitely for vaccinations passed on to their infant. It actually went into the breast milk as well when they were breastfeeding. And so the baby's getting protection from COVID as well as the mother getting protection from COVID. And we just talked about the stillborn rate and how unfortunately that has climbed dramatically higher during the Delta variant prominence here for women who ended up getting COVID while they were pregnant. And so again, just understanding how all that works. And now the last thing I want to talk about news-wise is Thanksgiving. Thanksgiving is coming up in a couple of days, and this is our big travel season to get together with family and friends. So what should you do as far as Thanksgiving, and how should you be safe and stay safe? Well, last year, if you remember, the recommendation was not to travel. This is before we had vaccines, before we had a handle on how to treat coronavirus or COVID in particular. The word was don't travel. So last Thanksgiving, for the most part, most people stayed home. This Thanksgiving, people are traveling, and we're already seeing numbers at the level of pre-pandemic numbers for people flying. And so we know people are going to be going to different places. The concern is, will they be getting sick there? Will they be bringing that back with them? And will case numbers rise dramatically like they did last year for the people who did end up traveling? If you remember, January last year, we were seeing around 300,000 cases. We don't want to get nearly to that level because we're a third of those cases right now. We don't want to triple that number and get to those again. At the same time, what do you need to do to stay safe? Well, first and foremost, if you can have a Thanksgiving get together with everybody who's completely vaccinated, then common thought is go ahead, have an old-fashioned Thanksgiving, do what you used to do before, and just really enjoy your time with family and friends if everyone's fully vaccinated. And what this comes down to is essentially 3 different categories here. Fully vaccinated, those who've been fully vaccinated and have boosters, especially the vulnerable ones, and those who have been unvaccinated. Now, if you've been unvaccinated, then you want to think about staying home. You want to think about not going to these things because you're at a higher risk of spreading COVID, especially to those who might be more vulnerable, especially to those who didn't get booster shots and are elderly, and the young children who aren't able to get boosted or able to get vaccinated at this point. So again, think about staying home, not attending these. The other thing, it's not unreasonable to do 2 different things. One is ask your guests coming over, are you fully vaccinated? And if the answer is yes, then please come on over. If the answer is no, say, sorry, let's go ahead and repeat this next year and see if we can get together next year. Hopefully the pandemic's under control. The other thing you can do, and a lot of people are doing this, and there seems to be an abundance of tests right now, but you can test people before they come into your house and just say simply, hey, we're in a pandemic. I took a test this morning. I'm negative. Do you mind taking a test before you come into my house? If you're negative, please come on in. Let's have a great time. If you're positive, obviously go away. The other thing, the third thing, is whether you're vaccinated or not. If you're feeling sick, stay home. Don't go on a trip. If you go on a trip and you get somewhere and you're in a hotel and you're feeling sick and you're about to go to the thing, don't go there. Get a COVID test. Find out if you're COVID positive, what you need to do with that, but don't go to these events. So again, fully vaccinated, everybody gets together that's fully vaccinated, then have the good old Thanksgiving we've had in the past. Enjoy everybody. If there are unvaccinated people, particularly if there are people at high risk, the elderly who, even though they're vaccinated, we know can have breakthrough infections, and those that are younger and might not be able to get vaccinated, then you want to think about wearing masks, social distancing, ventilating, opening up windows, or having events outdoors if you have unvaccinated people in there. So if there's a mixture of vaccinated and unvaccinated, you have to be careful. And that's probably the bottom line behind all this. But most importantly, have a great Thanksgiving, have a fun Thanksgiving, and there are certain ways to do it safely, but you want to be safe. So now let me see if you guys have any questions.
Is Pfizer's new COVID pill the same as ivermectin?
So the question is Pfizer's new COVID pill the same as ivermectin? No, it's not. So ivermectin, the issue behind ivermectin, it's an anti-parasitic drug. It's a drug we use to eliminate parasites in the body. It's used in animals, it's used in humans, and in humans it's used in smaller doses, but it's effective at eliminating parasites. That's what it does. The thinking was it might have some anti-inflammatory properties too. And that's where the story came in going, could this work on COVID? Could it help with COVID and that inflammatory response that people get into where they start getting into trouble medically? And it turns out it doesn't look like it's working very well for that purposes, and we know it can have some certain side effects. That's ivermectin. The Pfizer drug is a drug that we know directly affects the virus itself. It's an antiviral drug, and it directly affects the virus, stops it from replicating, stops it from duplicating, and that's where it works. But it has to be taken early on in your condition, early on in being infected, and you take it for a certain number of days, and it works to a certain extent, but it's not an end-all. None of these are end-alls. And the difference being, when you look at the vaccine, that's prevention. When you look at these pills, these antiviral pills like the one Pfizer's put out, that's treatment that works fairly effectively, but kind of like the masks and vaccinating, keeping numbers down, the pills and the vaccines keep cases under control if somebody does get sick, but not one thing does everything for everybody. But as far as ivermectin, does not fall into these categories. It's not been shown to be effective against COVID or COVID symptoms. As a matter of fact, there's multiple stories of people who took it to prevent COVID and ended up getting COVID regardless, and so not in the same category at all.
Why do we get only one vaccination for measles, but more than one for COVID?
So the question is, why do we get more than one vaccination for, why do we only get one vaccination for measles, but more than one for COVID? Because right now, COVID, so if you got Pfizer, you had 2 doses, day 0, 21 days later, Moderna, day 0, 28 days later, you get the second dose. If you had Johnson & Johnson, you get 1, and then the boosters come along, and then you get a booster for, depending on which shot you got and which booster you're going to go for, it's either going to be your third or your second shot. So the question is, why do we have to get multiple Pfizer or multiple COVID shots, but we only get 1 measles shot? Well, first and foremost, you don't just get 1 measles shot, you get 2 measles shots. And you get one around 12 years old, or 12 months old when you're 1, and then you get another one when you're between 4 to 6 years old. So you get another one 4 or 5 years later. And so, again, you're getting multiple shots, 2 shots. And what's happening there is the first shot, kind of like the first COVID shot, is priming your immune system to recognize it and giving you some protection. And then the second shot boosts that. Well, because these shots are so far apart, and the way measles works, your immune system is gotten a lifetime, essentially, of protection against measles by those 2 shots. But it's not a one-shot thing. And we think that measles lasts a lifetime, and that's what we're seeing. Has to do with the virus itself and the way the immune system reacts with the virus. With COVID, it's a bit of a trickier virus with our immune system, so we need multiple shots for that. But regardless, the bottom line is for both of these, you need multiple shots.
Should vaccinated people be scared of being around unvaccinated people?
Should vaccinated people be scared of being around unvaccinated people? I don't think they should be scared of being around unvaccinated people, but they should be aware of the consequences of what happens if somebody unvaccinated can spread COVID to them. Now, I know people are going to write here and say, and they are correct. You can spread COVID, you can get COVID, and you can spread COVID whether you're vaccinated or unvaccinated. But the difference being, many more people who are unvaccinated are going to get COVID and spread it. The rate is much, much higher than people who have been fully vaccinated, particularly people who have gotten their booster shots. And so the rate of people who are unvaccinated is going to be high. The rate of people who are fully vaccinated with booster shots are going to be low, and so they're not going to spread it quite as much. And so you want to be careful if you're in an environment where there's mixed groups of people who are fully vaccinated and people who are unvaccinated. If you're around a lot of fully vaccinated people, and that's all that are in there, don't really need to be that worried about it, because the chances of passing it on to somebody who's fully vaccinated and them catching it and having consequences are extremely, extremely low. But if there's somebody unvaccinated in there, they could certainly catch it and spread it much more easily, and you could catch it as well, particularly for people who are at higher risk, and that's the elderly, 65 and above, those with pre-existing medical conditions that put them at a higher risk for COVID complications, and the young ones who can't get the vaccine yet, those under the age of 5, or those 5 and above who haven't gotten the vaccine yet. You want to be extremely careful with them. So again, you shouldn't be scared of them, but you should be aware of the consequences of the fact that they are at higher risk of catching and spreading COVID, so you want to be careful.
Where can we go to get information about COVID, infection, death rates in different parts of the country and the world? So
there are a variety of places you can go to, and I use a variety of sources to look at the death rates, the cases, the hospitalizations around the world, and the numbers I quote you come off a variety of sites. The one I use mostly right now is called ourworldindata.org, and that's where I get a lot of this information from. Where they have great charts where you can compare countries, you can compare vaccine rates, you can compare hospitalizations, death rates. It basically has a variety of information, but there are a lot of sites out there as well. U.S. specific, the CDC does a great job of keeping things up to date. There's a site on as well called Stat that has great information that you can use that as well. And those are probably the three main sites I use. Johns Hopkins has some wonderful information. Just depends on what you're more comfortable looking at. And the one I've developed a preference for looking at is this ourworldindata.org, which lays it out very nicely and gives me information that's easily accessible, and I can spot it very, very quickly when I look over and glance from here. So I'm talking more to you and not to my computer. But those are the sources I use. So again, going over the headlines, thank you for your questions. Going over the headlines, number one, cases are going up in Europe. It could teach us some lessons. We're finding cases in countries are low if they're using a variety of things. Vaccines and masking in particular, that keeps them down. But in countries where they have low vaccination rates, goes up even if they have good mask policies. In countries where they have high vaccination rates but not great mask policies, those numbers go up as well. So that combination is what it's going to take, and that combination is what it's going to take here in the U.S. as well. We talked about the stillborn, how we're finding out that people who get COVID in the Delta variant era that we're having right now, it's over a 4 times increase in stillborns in pregnant women who get COVID during the Delta variant prominence than it was pre-pandemic. And so that's causing some issues, and that's another reason behind the advice for pregnant women to get fully vaccinated against COVID. And then Thanksgiving, we talked about Thanksgiving travel and how to stay safe during Thanksgiving travel. But the most important point I want to put across here is that, please have a wonderful Thanksgiving. Please have fun with family and friends, but do it as safely as possible. If you haven't gotten vaccinated, think about getting vaccinated over the next couple of days. It won't give you any protection or give you very minor protection over Thanksgiving, but at least jumpstart that process. So when the holidays come up in December, you're a little more protected. And then going into the new year, you're even more protected. And so again, think about doing that, if not just for you, your family, and your community. But as always, I hope you, your family, your community, and your loved ones stay as healthy as possible, stay as happy as possible, and have a fantastic Thanksgiving. Talk to you later.